Building.
You can say hello.
We have back with us today, we have Ricky, Hector, and Lixon, and we're gonna talk about.
Hi. Okay, you can already see how this is going to go.
Today's show was a special show because we're going to talk about what men versus what women go through dealing with sickle cell anemia in our adulthood. So if you have somebody that you know, just share this page, share this live, tag someone so they can watch and they can log in and get some good information on what we go through and what we can do to help ourselves on a daily basis. All right.
Yes. All right. So if you have a question, you can also post it or make a comment, and we'll try to answer some of your questions. And Dr. Harrington will answer it. So let's get started. Okay. All right, Dr. Harrington, before we ask the guys the questions, we just want to ask you, can you give us basically a brief statement? What is sickle cell? What is sickle cell? What is sickle cell trait? The differences of the hemoglobins. If you can break that down to our audience so they can learn about what is sickle cell.
Okay, just by describing it makes it a little complicated. I mean, pictures or graphs, but okay. Hemoglobin is a protein that's made of paired proteins, and in sickle cell there are two beta globin chains, and one of them from each parent. And in sickle cell disease, SS, each of those beta globin chains has a mutation that makes it sickle. There's another variant that's also kind of common called hemoglobin C, and in hemoglobin C you don't get the same degree of sickling, but it's also an abnormal protein that you get from one of your parents, and it interacts with hemoglobin S and does cause red cell damage and pain. And then there's a third type, and actually we have, at this table, we actually have people have all three variants. The other one is called S-beta-thal, beta thalassemia, where you inherit sickle cell gene from one parent and then a loss of the other normal gene for the other parent. You don't get an abnormal gene, you just don't inherit a gene, and you don't. And so in S-beta-thal, you don't make any normal hemoglobin, and you make all hemoglobin S with some variants that I won't bother going into, but it can be a serious subtype. Okay, but these are the three main serious subtypes of sickle cell.
Okay. Who is affected by sickle cell disease?
All right. The reason the gene survives, it survives in areas where over centuries, thousands of years, malaria actually selected out for it. People who live in Africa, where the gene is most common, areas of India, where it's just as common as some areas of Africa, and other equatorial areas where when you have this gene mutation, even a sickle cell trait, people who have sickle cell trait actually have a better chance of surviving malaria than people who don't. It helps them clear out the parasite a little faster in their spleen, and it just lowers the amount. It's not individual people don't get so helpful, but a population like hundreds of people with sickle cell trait would be more likely to survive than people who have normal blood.
Wow.
And that's why it makes it survive. The problem is, when you have both genes, it doesn't really protect you and actually makes you suffer, obviously. It causes a lot of other vascular problems. And the benefits of having a sickle cell trait now are gone because we have therapies for malaria. So it's a gene that survives, but it survives in tropical areas, and that's why it's more common in Africa and India and some places like that, because those are areas where the malaria actually helps select out people who have that gene.
Okay. In your profession, in your experience, seeing men and women with sickle cell, who do you think suffers more?
You know what? It causes a lot of suffering in different ways. Women probably have more crises, and the reason they may have more crises is because of the period and hormone fluxes, hormone changes. A lot of women who have a lot of problems around the time of their period, it's not universal. Some women don't have anything worse around the time of the period than a regular menstrual cycle pain. But some women have predictable crises, and some women every month they almost have to go to the hospital because of how bad their sickle cell crisis. And it seems to be due to the estrogens and hormone surges that happen. So women have that, men don't. Women also have to deliver babies, and pregnancy in sickle cell can be very difficult for some patients, and they can also have not only difficulties with themselves during the pregnancy, but they can also have difficulties during delivery. The babies are often underweight, not universally, but they can deliver early, have somewhat underweight babies. So there's problems, and there's also even associated increased risk of forming clots, DVTs, things like that you can have, and pregnancy is also an increased risk for that. So women have those particular issues. Women always have more because they have babies, because they see doctors more often. They may get seen more often, but a lot of women do very well and don't get sick that often. There's probably a lot of other genes that interact with that. But I'm not going to pick a side.
No, I mean, I know what you mean.
Men have their own particular problems that that we may talk about. That's something that is excruciating.
We'll talk about it.
Right, yeah, we can talk about it.
I mean, we could talk about that now if you want, but it's priapism, which is a condition where you get prolonged painful erections. These are excruciatingly painful, and they generally, as a rule, they occur in these nocturnal erections that normal males get. From adolescence to adulthood, the normal men will get several erections overnight. And when they get these, the neural signals that cause that are different than the kind of erections you get when you're having sexual activity. So priapism is not usually associated with sexual activity. It's usually associated with these nocturnal or resting, if you will, erections that men can get. And they can often, it typically happens at night, and they wake up in excruciating pain. They wake up in the morning, they wake up anytime at night, and it causes a lot of stress and pain, but it also causes a little fear of sleep. Some patients who get frequent priapism.
So, guys, hearing this, I mean, I don't know if you guys want to go straight into this. We want to. Okay, we're going to talk about it. Dr. Harrington just explained what is priapism, and thank you for that.
Actually, I didn't explain it.
Oh, okay.
I thought from here, but
you're going to leave it up to us to
No, I'm just going to say that the mechanism is the blood flow into the penis that normally occurs usually is followed by blood flow out of the penis, but it's the blood flow out of the penis that's impaired. So you get blood flow in, and it doesn't flow out like in a normal way, and that leads to these what they call ischemic priapism, or tissue damage, and you don't get oxygen. So it's actually very, very painful. I'm sorry. Go ahead.
Yeah. Okay. So yeah, that was a lot of detail for viewers today.
Could be more detail.
If you're watching, we're just trying to be more transparent today. That we as sickle cell patients may go through, whether male or female, and we have our men that's here today who have a daily deal with sickle cell daily, and as he mentioned, he was talking about priapism, and I know some of you have said they, kind of mentioned that you have been through this. And go ahead, who would like to talk about it?
Well, before they talk about it, I've never had this, so I need you guys to explain it for me.
Okay.
Wow.
Yeah.
Did he just throw it on me? Did he
Well,
just throw it on
we
me?
had someone, sickle cell soldier, for some of you guys who are watching. He was supposed to be on our show today. He's had actually a YouTube video about his experience, but he is in the hospital. Our warrior is in the hospital, so that is why he is not on with us.
Stay strong, my brother.
Yeah. And he was willing to share more about his experience and how it affects him a lot. So I'm sorry, Ricky. So I said, if you want to talk about it,
yeah.
If not, we have other questions.
I guess Ricky could take it. I haven't, I haven't had an experience with, a situation with that. So
am I the only one around here?
We're gonna move on. So you want to talk about it, or you want to move on? Let's move on.
Basically, it hurts.
Oh, okay.
So for those who haven't had it,
Yeah, I mean, a lot of people have had it, but not everybody. It's not universal, but the people who have it, sometimes that's the only thing. I know patients who the only thing they were suffering from was that. But it's a serious, very serious thing. It's actually a sign of serious vascular problems. But it's also tough to talk about. So when you suffer that, it usually happens when you're a teenager. And that can be something you're not even sure how abnormal it is. You're just discovering your body, and you may not have anyone you talk about. When it gets very painful, you may recognize there's something to do, but it's something that is very challenging, and people get embarrassed about it. But doctors and nurses don't appreciate how serious it is, and initially they have to learn about it. But it's a very, very serious medical emergency.
Yeah, and I mean, last time when you were here with us, you opened up to us, and because I didn't know too much about prior prison, so I was like, I began to hear about it, I think, early on last year, and I didn't know too much about prior prison, and then when you open up with us on this show, it's an issue that some of the guys do go through, some don't, but it's a difficult issue, but. And I think it makes you stronger, to be able to.
yes, it does. Yes, it does.
Yeah.
Yes, it does.
And I know you mentioned Soldier, so I think he should be the one to tell his story. But yeah, I saw his documentary, and he goes out and he tours and explains this, and I told him, you're my soldier when I saw the documentary, because it's brave of him. Not like the doc said, not everybody likes to talk about something like that, That's true.
Also, if you don't talk about it, you might suffer, much more than you have to, including damage. So it's something that, as much as you don't want to talk about it, it's very important. It's unfortunate that it happens, but if you don't treat it, it becomes very, very bad.
And since you're saying that, like, how do you? I know there, for those who go through it, there is a way to treat the issue when it happens. Dr. Harrington, do you want to? You want to say it? Okay.
Treating the issue. It should be called. It should be called giving you another problem.
Okay.
Because the steps that they go through to treat that issue, they stick a needle.
Okay.
About longer than this, but
Yeah.
they actually, like I say, they have to stick a needle in that area to drain out fluids to get it to go down. But that's if it stays up longer than 4 hours.
Now, 4 hours when they start to consider a serious event.
But thank God I have never had to go to the hospital for it. But trust me, if I could pass it on to my worst enemy, I would.
No.
Trust me, it's worse than getting kicked. Actually, feeling like getting kicked, but let's just say.
Okay, so that's how it kind of feels. Okay.
You feel it.
So now you kind of have a mental description, guys, that who don't deal with that issue. You said it feel like you're getting kicked, and where.
Yeah.
And
just sickle cell. You guys have all dealt with a lot of sickle cell pain, and that's treating that is very important. Pain management is very important. But priapism, in addition to treating the pain, which may help it, you have to do interventions. You have to. Sometimes they inject a medicine that causes vasoconstriction, decrease the amount of blood flow in there. It's called epinephrine, like Sudafed type drug. And sometimes taking Sudafed orally can even help. So the things you can do to try to prevent these is. I'll just talk forever. I'm sorry.
No.
I think it's important because there might be males out there that don't discuss it or may not go to get it treated. You can have actually damage from that, right?
Yes,
if you don't get a treatment.
Right.
Yes.
There's a thing called stuttering. It's a term of stuttering priapism. It just means repetitive, brief episodes where it may resolve on its own. But if you have that is a serious sign, and we'd like to sort of intervene. And one of the things we use is drugs like Sudafed, like over-the-counter decongestants, because those decrease the blood flow in there and stop that. We also use other drugs, sometimes asthma meds like brethine and terbutaline. Sometimes we go as far as using anti-androgens, because they use for prostate cancer, decrease testosterone, because that's associated with that. But that's usually in more advanced cases. And there are other things that you use medically to try to prevent it, but when you have an acute emergency, then injecting that medicine and, like Rick was describing, sometimes you have to drain out this sort of thick blood that's stuck in it, and it's very excruciating. So pain management is very important while you try to deal with the problem at hand.
Okay. So for those of you who are out there, you know, we do like to, for our show, we like to tell people that some of the symptoms we have to go through as sickle cell patients. And as you hear, we have talked about priapism. We're going to also talk about some other things that
women go.
no, we're going to talk about
get into us.
Yes. But as patients, let's go to this question. You know, as patients, you know, what are some of the things difficult living with sickle cell?
As a patient?
As a patient?
Well, you know, what do you find difficult living with sickle cell?
Wow.
Clarity?
Yeah.
Well, my personal, me.
Give me like one. Yeah, one main. That is your difficult. Okay, 2.
One difficult?
Yeah.
Put it like this. The main problem that I had, like, really living with sickle cell is because I wasn't able to do everything that the person that's the guy on the next to me, like, if he can run a mile, I should be able to run a mile with no problem, no pressure. If he can take that hit, I can take that hit.
But that's not the case.
But yeah, but it was always something. It was always something where it was physical, where it was mental, like where it was, if it was asthma, if it was because, them like, I have to worry about the weather, like something always plays a part.
I can actually say that we actually use a term, loosely, it's just like a little joke amongst each other. We call everybody that don't have sickle cell, that's friend of ours or whatnot, associates, we call them normies.
No, that's true. That's true. That's true.
So that says it all. That says it all right
We
there.
are not normal.
Like normies.
That's true.
So, yeah, that says it all in a nutshell.
Okay, that's different. I never heard that.
That's true.
I always wanted to play basketball and football just like my big brothers. I always felt like I was able to do it as a kid. Like, you don't have no limitation because you're a kid. You want to do everything. You want to be an astronaut, baseball player, football player, everything. Then as you grow up and you start to realize, hold on, 1 minute I'm okay, the next minute I'm in the hospital. But it's still not making sense to you because you're a kid. So you can easily forget about these things. But as you get older, you get wiser and you start to remember things that you in reality hits and you really can't. You gotta be careful. You can't do whatever you think you want to do. Whatnot. That's the word "can't." I don't like to use it, but
Yeah, I
you have to
mean,
be careful.
You can explain why, Dr. Harrington, why.
This is a show also that has kind of thing. It has the spin on us being guys, like what are things that we've dealt with. I mean, yeah, that's a part of it. But I mean, I guess maybe because of the fact that having sickle cell, I wasn't able to do certain sports. Maybe that turned me off to sports. But then I got into music and tried to channel what I couldn't do with something into something else, And I know on the last time I was like, actually, because of sickle cell is the reason why I'm so good at guitar, So that's a kind of a positive that came out of it. But it's, for me, as a male, one thing that I feel like I think I'm a nice person. I think I'm a laid back person. I think I'm an approachable person, and I think I'm not a person that has a short fuse. That being said, as a male, don't mistake the fact that I have sickle cell. Doesn't mean that if you confront me with disrespect, that I won't do what I have to do, or that if I have to protect my family, that I won't do that, because sickle cell will not stop me from doing that. So as a male, that's one of the things that I find.
We're not weak.
Yeah, yeah. Far from it. Far from it. So I think that's a very important issue, because I mean it's not an everyday thing, but as males, people fight. People get into confrontations. And there has been occasions, where that has come up. And I'm not trying to go that route, but you know, this is about males and things that males, you know, deal with.
Yeah.
And yeah, so that is a point, you know.
Okay. Since we're talking about it,
Because I was gonna, my question was, I think Ricky and Lixon touched on it about you know, you seeing your friend or normies,
Yeah.
doing other things. I was gonna ask about you know, when you feel like you can't do your manly duties as a man, does it bring on like some type of depression or something like that? You know, or does it get to your mental?
Yeah, of course. We're human. I can say on behalf of even males that I've never met with sickle cell, we all, males and females too, like as humans, we all been through that time when we're at our lowest points and we think very negative, and it happens in the wow.
Yeah.
So, but actually, you know, but pertaining to male particular, we have egos. We're very competitive. We communicate with each other differently than women. I'm sorry. And yeah, I'm like, I bet you can't do that. I'm like, yeah, you know, whatever. And just like Hector said, you know, that was a negative and a positive, because just like he said, he got better in guitar playing because he couldn't do that. I got better in writing poetry.